my favorite people and doctors, Dr. Susan Caldwell. Thanks so much for doing this again with us.
Yeah, it's great. It's my pleasure.
We chatted with Dr. Caldwell a little over a year ago in our first interview. We were at the other clinic, and so I'm going to link that in if you want to watch that. Just click above my little finger here. So now you're in these new fancy digs, though. How about this place? How has it been?
Yeah. It's great. It's been wonderful to be here since October, right? In the first week of October, we opened
and what, we're
the doors.
June? Yeah.
June. And it's just beautiful.
It really is.
Just anybody who's in the area, I invite you to maybe stop in and just see it. I think you'll maybe give them a little tour.
Yes, yes. And it was built from the ground up.
It was.
It's a brand new building.
Brand
on
new.
Claiborne.
Brand new.
Claiborne
Yes.
Avenue.
Yes. We had a patient came in for her checkup, and she said that she felt like she should have worn a dress to her appointment because she felt like it was just so beautiful and so fancy. And then somebody else said they felt like they were at a spa when they were here.
Hope Women's Clinic is getting fancy. Y'all have arrived.
Yeah, well, so, women deserve this.
Oh, so true.
The day has come.
That speaks to so many of our meanings and levels on what we do over here, right?
Mm-hmm.
So what we are talking to Dr. Caldwell today is about birth control. We are finally like getting down to it, breaking it apart. What is it really? It's become such a norm in our culture, like around just like it kind of seems like everybody is just on birth control. And if you were to ask like the average person, what is birth control? You're going to hear A, avoids pregnancy, or B, regulates my period, or gets rid of my symptoms, helps me to feel better. But we know that there's a little bit more to the story. So as a doctor, as a professional, in your experience, what is birth control?
Well, my answer to that has evolved.
Yes, it's got layers.
It's gotten some layers on it. So as a woman who used birth control myself for maybe about 10 years, I would have said exactly what Mary just spoke. And then as a doctor who was taught in medical school that it was really the standard of care and it's really the treatment that every woman deserves that we needed to provide in order to be good providers and good doctors to our patients. So I would have probably said the same thing. However, there was a shift in my practice somewhere around 2010 where I all of a sudden started to see the reality of the harm that birth control was causing in many women's lives and bodies.
And that was patients that you were seeing and communicating. So you have a pretty big population sample set, so to speak, to get an idea of how it's making them feel.
I just heard horror stories. You know, women who were promised that birth control would maybe take care of their symptoms, and then they ended up with different symptoms. So there was like an exchange for one set of symptoms for another set of symptoms, but it wasn't a good deal for a lot of these patients. And then the ones who would come to me with really bad outcomes, maybe it's a cancer or high blood pressure or mini strokes and things like that, it just caused me to say, wait a second, is this the best treatment for women? There's got to be something better.
Can you briefly just say like what birth control is actually doing inside of our bodies a little bit? Because I don't think people are thinking about it because it's the norm. It's just, oh yeah, everybody's on birth control, I'll just take it. But what are we not seeing? Like, what is it doing?
Well, first of all, let's define our terms.
Okay.
Birth control itself means something that we're doing to prevent pregnancy. So there are many forms of birth control that we're not going to talk about today, right? And those are things like condoms and different ways of non-medical or non-technological means of birth control. So we're really not talking about those things today. We're really talking about things that are intended to change a physiology of a woman's body, right? And so the most common would be the birth control pill, or any form of artificial contraception, if you will, that changes how we ovulate. In other words, prevents ovulation. So ovulation is really what happens when we produce a follicle that then causes us to release the egg, which lives in the follicle, and then that follicle turns into something called the corpus luteum, all again on the ovary, that gives us, the corpus luteum gives us these beautiful hormones that we need.
Very normal process, right?
Called progesterone and estrogen. So what birth control offers instead is a way of, if you will, shutting down that process of ovulation. So we never have the benefit of getting those hormones that make us feel normal. Right. So what happens is our lining of our uterus doesn't grow because of those hormones aren't made, right? There's just a little bit of a growth of the lining, but not enough that would result in a healthy pregnancy if an embryo was conceived.
Right.
And so really what it does is it makes your body do something it's not meant to be. This is one thing that I think, one way of just capturing it that might help people who are maybe outside the medical world and just need a sound bite. But so it's the one place in the world of medicine where we give someone who's healthy something to make them sick and call it good. Okay, just be careful if anyone offers you something and tells you it's good when really it's there to make your body not function well, right? So none of us would accept that if it was our liver or our heart or another part of our body.
And if it was communicated to us that way. It's communicated to us by our doctors, people that we trust, in such a tricky way, right? So we don't really see that.
Right. But in all fairness to them, they are taught that it is simply normal and good.
Right.
So it is something that we need to trust that it is good, and then give it to our patients again as something that is good.
Right.
But we all need to use our intellect, our reason, our capacities for understanding things to really think beyond the surface.
Yeah.
And beneath the surface, and ask, is this really good for me? And really, if you have a conversation with your girlfriends and you get in a conversation about just the pill or birth control, you're going to hear a lot in that group about what it causes: weight gain, depression, irritability, all kinds of symptoms that shouldn't be tolerated.
Right. Which is why we're here breaking it down for you today, right? Now let me ask you really quick. You mentioned that it breaks down the lining of the uterus.
Or doesn't allow it to grow properly.
Doesn't allow it to grow properly. Is it possible that it could, if a baby, an embryo was implanted, that it could technically kind of cause like an abortifacient, and you wouldn't know it?
Right.
A lot of people I don't think realize that is part of the birth control and preventing pregnancies, is that it's possible that an embryo could be conceived and planted, but can't survive.
Can't survive in that little thin lining there that's prepared.
That's so scary to think of that.
Yeah.
But so you just talked about symptoms, that we could have, and talking about, with our girlfriends and stuff, and how it delivers synthetic hormones, right, in order to shut that normal process down that you just explained. But so with Napper Technology now, with your new practice and how you've been doing things, it's a little bit different, right? And we can provide even better results in a natural way.
Right. So when I realized really how bad, if you will, technological contraception was and is for women, then I couldn't abandon my patients, right? And say, well, you just have to live with those bad periods, or you have to deal. So I discovered through, a lot of just great people and resources on this whole concept of Creighton and Napro. And y'all all know that by following Mary, what those things are. But with Creighton and Napro, wow, a whole new horizon has been opened up for me as a doctor, because really what I really want to do, and I think what all doctors out there really want to do, is help a woman to be healthy and to thrive.
Yes.
Right? We don't want to replace or shut down what is a normal process. But if we think that's all we can do, then we do it.
Right, exactly. You didn't get into this line of work because you don't really care about your patients, and for women, like for what's really best for the woman.
Right. But without a chart, there's no way for a doctor and a patient to communicate about the signs or the clues of what's wrong.
Right.
All a woman can say is that my periods are heavy. Well, I need to know how heavy, and I need to know what the bleeding frequency is and the pattern of bleeding is, and do you have any sign that you're ovulating? And all these questions really need to be answered before we can have an honest conversation that leads us to a healing solution, right? And that's what the chart gives us.
It's kind of like a little investigation, like a mystery. Like, let's solve this mystery. We just need to give you the information, the tools of what's going on inside of our body in order to be able to do that. So now that you're in your new practice, you have a lot of experience. Now you're not prescribing birth control, correct?
Right, for the past 7 or 8 years.
Crazy. I think that's like unheard of by a lot of people. Never heard of such a doctor that doesn't prescribe birth control. They do exist.
Right, because we have something better, right?
Right.
And women need to understand too that our cycle is really another vital sign, right?
Yeah.
So when our cycle is not as it should be, it's a reflection of something that's out of order in our physiology. And so we might want to know, if you had a terrible headache, you'd want to go to your doctor to help figure out where the headache was coming from, right? It's nice to take medicine for your pain, but in this way, it's even more important than a headache. Because our cycle says so much about who we are and how we function. Women should know that and be able to have a provider that can help them to find solutions that restore that order rather than just shut it down and dismiss the symptoms.
Yeah, and ultimately, birth control is just kind of shutting the system off, right?
That's right.
It's like going into like a robot mode, unplugging it, or so to speak.
Yes.
So you don't know what's going on.
Right.
So we want to plug it back in, get off the birth control. Let's get an idea. That's what the Creighton model chart tells us, or tells our doctor what's really going on. And then we can move forward with a plan of action. What are some things? We talked about birth control being synthetic hormones, but with NAPRO, we use all natural bioidentical hormones.
Exactly. So with the hormones we use in our treatments, they are exactly chemically identical to the hormones produced by the ovary. So remember we talked about the ovaries making these great hormones that make us feel normal, i.e. estrogen and progesterone. So we never want to take an imposter.
Yeah.
We need the real thing. Yeah. Right? Because our body, every cell in our body is designed to respond positively to the real thing. And the cells in our body will respond negatively, right, to the fake stuff.
Something foreign.
Right? And so that's why if you go to the American Cancer Society's website and look under types of carcinogens, you're going to see right there under Group 1 carcinogens, the highest form of carcinogens listed there, birth control. Right? It is the highest form of carcinogen because it is not natural. It is not, our cells in our body do not know what to do with it. And so there's going to be problems from taking it.
Which makes sense, and it's such a craze right now, like Whole Foods, Trader Joe's, everybody wants to eat naturally. We don't want to put these synthetic hormones into our foods. And I think more women are becoming more aware. They're caring about this type of things. But that's exactly, for those of you who don't know, that's exactly what's happening in birth control, with the pill at least.
Right.
So kind of on a different level, you have relationships with your patients now that you've not been prescribing birth control. Beyond the effect it has physically on the body, what about, mentally, emotionally? Can you talk a little bit about the difference that you've seen in these women, just on a personal basis, with their happiness?
Yeah, I think one thing is that when women are being listened to instead of dismissed, that just brings us to life. I mean, there's something about being heard. So first of all, they're actually having a conversation with someone who wants to hear what's wrong. Yeah. And so that's beautiful for me to be able to hear that. And just the studies come over and over again are coming out about the number of patients who complain of depressive symptoms and anxiety. When I used to prescribe the pill a lot for acne, it was just kind of a little bit of a joke between a colleague and I that, which is sad, that almost every birth control prescription went along with a prescription for anxiety. Oh. Very common in young women. right? And so we kind of joked about that, but now that I'm looking back and seeing that, it is so true. It just, again, messes with our physiology. The cells in our brain need estrogen and progesterone. They don't need ethinyl, estradiol, all these funny chemical names.
Right.
We need the good stuff. We deserve the good stuff.
Absolutely. Again, there we go. We deserve it.
We deserve it.
We need to fight for more of this.
Yes.
Right? What about relationships? Is there any? I don't know. I'm just asking you if you've noticed anything with subjectively.
Yeah. Boy, this is a
tricky
topic. This is a topic I could talk about for a long time.
Okay.
But we are created not as rabbits, right? Rabbits were created, and cats, where when they come together, the male and female come together, the female ovulates. Okay, so those are reflex ovulators, right? So I know, but imagine if we were created that way, right? But we're not, right? And so there's something beautiful about respecting the natural, the times of fertility and infertility. And so when I feel like I don't feel like it, I see it. When a woman knows that her partner, husband, understands those things and understands her and the depth of what's going on in her body and respects that, there's a possibility, a capacity for intimacy that you just can't get with birth control. So it does cause problems in the relationships.
And it's transcending what I'm saying, from just the body. But also another aspect of it is where before, if the woman is just taking birth control, you're not really communicating a lot. And so when you learn to chart, your partner, your husband comes with you, hopefully, to the first, he's learning it with you, which is so beautiful. It's something you start to do together. You're communicating about your fertility, because your fertility it's not just a woman's, it's both of your fertility, right? So it becomes something that's like a teamwork and ends up, I know in people I've talked to in my own experience, improving marriages. It has that possibility, which is nice.
But it can also do the opposite, right? So it is difficult, I will say, for couples who are used to the spontaneity of birth control
for sure.
to then change. But again, it's a chance for the relationship to deepen, for the intimacy to deepen, and there are people who do not want that.
Right.
Oh, who don't want that level of intimacy. So it does become a stumbling block. But again, if there are any women out there that are dealing with a relationship like that, where if you put a limit on the sexual activity, if that became a point of contention in the relationship, then that's important to know as well, because that may not be a relationship that is meant to be.
Right. We're giving you all sides here. We're being real with you, which is what we want, because we want you to get the full story. Just to help you make decisions when talking about your health care. One more thing that I wanted to talk about, you mentioned, which really stuck out to me, is women want to be heard. Ultimately, we just want someone to sit and listen to us. We don't think we can get that from our doctor. I think we have settled in just accepting, I know before I heard of NAPR technology and I had this other doctor, it was a pretty quick appointment. I know my first one it was just, oh, you have pain, you have this issue, okay, you want birth control, no thank you, okay, see you later. There really hasn't been someone to sit down with me and be like, so what is going on here? What are your symptoms? What are your issues? So one aspect is you're spending more time. That's what I'm getting at, is your patients, you have to block off more time, correct? And it's actually a little bit harder for you because you're spending so much time with a patient's chart, getting to know them and what's going on. I just think that's nice, and I wanted to highlight that.
Yeah, but also that for doctors who are working in a big corporation of medicine, it is difficult for them to control how much time they spend with patients. So this is also not just a problem in certain doctors' minds, right? But this is a real problem in the culture of how we do medicine. And that has to change, honestly.
It's got to change from the top.
That's right. So there's so many
education.
places, but somebody's got to start the change, right? And so we invite you as women to start with your doctor, asking for a little bit more, that
advocating
for yourself, learning how to chart, just Yes.
Do your own research.
Right.
And that's taking back the terms. Women empowerment is one of those terms. And women's rights. We have a right to know these kinds of things. And if we're really going to be empowered, if we're really going to own that, then this is what that means, I think.
I agree. Yes.
Okay, so thank you again so much for taking some time to talk about this stuff. I know I appreciate it. I have a doctor out of state, but she is my doctor here, and so, but she can be your doctor too.
Yeah.
So she's, again, on Claiborne in New Orleans at Hope Women's Clinic, but you don't also just see fertility patients.
Right.
What kind of patients can you see?
So I'm board certified in pediatrics and internal medicine. So we invite adolescent young ladies who have recently started their period to come here just for their primary care. We only discuss periods and cycles as it relates to their concerns.
That's good.
Right? That's not our focus here, like it might be in a gynecologist's office. Yeah. And then we see a lot of women for just primary care issues and wellness. And then lots of primary care related to their cycles and their well woman exams, and then all the way up to complicated hormonal conditions that require, treatment and NAPRO.
Also, if you need a checkup or you have a cold, you can come in and see you for that too.
Yeah. Although we've been getting kind of busy with a lot of the hormones, so it's harder to get in for colds and things like that.
Right.
But yes, if we have spots, come on.
Okay.
Yeah.
Sounds good. All right, thank you so much for tuning in. Again, share this video so that we can reach this wonderful information. That didn't sound right. So that we can reach women and others with this wonderful information is what I'm trying to say. And follow us, subscribe to us on YouTube, Facebook. I'm also on Instagram, and message me with any questions. If you are not in the New Orleans area, but you want to find someone with this awesome care, www.fertilitycare.org. Lots of good stuff there. And so until the next time, you'll have a great week.